At his family's home in Melbourne, memories of Max Mackenzie are everywhere.
This is Max's room down here.
3 years ago, Ben Mackenzie received the news every parent dreads. His 15-year-old son, Max, was dying, suffering from anaphylactic shock after mistakenly eating food containing walnuts.
When I arrived, the paramedics had left and he was being treated by the emergency department. So this is Max's Millennium Falcon.
Ben Mackenzie, an emergency physician, says he had to intervene and insert a breathing tube, but it was too late. Max had suffered brain damage and fell into a coma. He died 13 days later. His death is still being investigated by the coroner.
From my perspective is that, well, you know, you need a certain amount of adrenaline and you need a certain amount of oxygen, and there's different ways of giving oxygen, and Max just needed adrenaline and oxygen, and there would have been a different outcome.
The hospital declined to comment as the matter is the subject of a coronial investigation. Dr. Mackenzie believed his son had been the victim of what's called a sentinel event, a mistake in the healthcare system that causes serious harm or death. He ended up reporting it to the state agency Safer Care Victoria himself.
It was at Christmas time, the year that Max died, that I had to notify Safer Care when it became clear 5 months later that it hadn't been reported as a sentinel event.
Sentinel or adverse events are just one indicator of health system performance. And if anyone can paint a picture of what's happening in Victoria, it's Dr. John Wilson. 2 years ago, he stepped down from his role as a senior doctor at one of Melbourne's leading hospitals, the Alfred. In the time since, he's researched the performance of Victoria's public hospitals using publicly available data.
The indices that I've looked at have clearly shown it costs more to run health in this state than any other state in Australia, that the outcomes in terms of serious adverse events are worse than they are in other states.
In fact, Wilson found the most recent Productivity Commission statistics revealed Victoria had twice the number of sentinel events of New South Wales, the next highest state. Wilson left Victoria's public health system as it emerged from the enormous strain of the pandemic. His research found a few years later, things are much worse.
How do you think the system is doing 2 years after the main impacts of COVID have been experienced in the health system?
We're not in as good a place as we were then. It should cost less without COVID. We should have less sentinel events. The staff should be happier and feel safer. But all of those have gone the other way.
Very nice to meet you.
Victoria's health minister concedes demand is higher than ever.
There's so much to be proud of here in Victoria, but there is no doubt that our health system is under pressure. We have seen record demand on our health service system. In fact, last year, we had around 2 million presentations to our emergency departments.
Day after day come reports of a hospital system close to buckling. Dr. Mark Putland is with the Australasian College of Emergency Medicine.
Compared to how things were a few years ago, now we start our day really running at 110%. It's full at the beginning of an 8 a.m. shift, it's full at 5 p.m. when the evening shift come on, it's full at 11 p.m. when the night shift come on.
And when there are no beds available, the Director of Emergency Medicine at the Royal Melbourne Hospital says it doesn't take long for the backup to impact patients.
That means they wait in a waiting room, that means they wait on an ambulance trolley ramped, it means they get squeezed in where they can into non-treatment spaces, and that just isn't good care for patients.
Despite those problems, last month Victoria's government said the state was Australia's leader in health.
There's 7 million people in the state. Do you think they really believe Victoria has the best health system in Australia?
Well, again, people will have their own experiences of our healthcare system to share. And I know that not everyone will be satisfied with the care that they receive. But by and large, we continue to deliver world-class care to the majority of Victorians that access care in our system.
As many patients know, clogged hospitals mean longer waits in emergency. Victoria has a target that 75% of patients in the ED are seen within 4 hours. Last year, they missed that target, and only 54% were seen within that time. Dr. Sarah Whitelaw is the emergency medicine representative for the Australian Medical Association.
If we look at our performance in Victoria in the last quarter, we have 3,000 patients waiting over 24 hours in the emergency department. That figure to us is pretty shocking.
Productivity Commission data shows the strain on public hospitals is happening despite Victoria paying the most in the country per treatment. And Dr. John Wilson's analysis of 6 major Victorian public hospitals reveals operating expenses have more than doubled in the past decade.
I've noticed that from annual reports from public hospitals in Melbourne that we've seen that operating expenses have risen much faster than population numbers, much faster than those attending emergency departments, and indeed faster than the population growth itself.
Why is Victoria the most expensive jurisdiction in the country in terms of cost per treatment?
Here in Victoria, we have the most devolved health service system in the nation.
Victoria has 76 health service groupings. New South Wales has 16. The minister is hoping changes will lead to more efficiencies in the health system.
I have a reform agenda that is about getting our hospitals to work better together, so that we put the patient at the centre of all of our decision making, and so that we can look to drive down some of the back of house costs that all hospitals experience. So things like ICT, HR and so on.
As the pressure on the health system builds, it's not only patients paying the price.
The impact on staff is terrible, there's no question. All around the state we have members telling us about that. And it's not just emergency staff, it's also ambulance staff. What people have is moral injury from knowing that there's a standard of care that they want to be delivering and they're just simply not delivering it.
A health system with costs spiraling and outcomes worsening for patients and staff. But these practitioners believe it's not too late to fix it.
The best thing that you could do for us as emergency physicians is invest in primary care and invest in general practice.
It's about each health service finding the right people, investing in their people, giving them the time and resources to be able to do the simple stuff that makes our hospitals safe. We live with this tragedy and loss every day, and making sure that another family doesn't have to go through it is really the thing that makes me wake up in the morning, because otherwise it's just too horrible to try and face each day.